This presentation is going to be healthy eating throughout the lifespan. So throughout the slideshow, there will be some multiple choice questions. I want you to think about them thoughtfully and answer them, and then use it as a self-evaluation tool. The first group we're going to talk about is infants. So babies go through a unique and rapid pattern of development in their first stage of life. Their brains are growing at a fast pace, and they're also growing on a growth curve. Breast milk is considered to be nutritionally better than formula and also provides immunity. But however, iron supplements are often needed for breast milk fed babies. Babies can, however, live off breast milk or formula alone for the first 6 months of their lives. After this point, rice cereal or another solid similar is usually introduced to their diet, and this is usually mixed with breast milk and formula as they continue to take in either of those. During this phase, baby's hydration status is monitored through a wet diaper count. When you're assessing the baby, you'll be able to look out for signs of dehydration rather, but getting the wet diaper count history from the mother for the past 24 hours can also be indicative of their hydration status. So let's look at the first question. Which of the following assessments is most indicative of an infant's nutritional status? Is it a latch assessment performed by a nurse or a lactation consultant? Is it a height and weight assessment of the baby measured at the doctor's office? Is it sleep pattern and cycles of the baby? Or is it a wet and dirty diaper count assessment provided by the parents? And the answer is B. So the doctor is going to be doing an assessment of the nutritional status based on the height and weight of the babies. They'll be plotting their assessments on a growth chart to be watching the progression of the baby's growth. However, diaper counts, breastfeeding and formula feeding history, and latch assessments all go in, are there important assessment factors to doing a complete health assessment of the newborn. So you'll be recording all these assessments, but the height and weight will be the most indicative of the nutritional status of the baby. One thing to think about, there are many factors that can hinder a mother from being able to breastfeed. So it's important to be sensitive of the issues that they might have. Sometimes women have to go back to work early and it doesn't work out, or they might be on certain medications that makes them unable to breastfeed. We have to remember it is ultimately the mother's choice, and we can educate, but we want to remain sensitive on this issue. So the next group is going to be toddlers. So toddlers' diets need to shift to a higher fat and protein content. They become a little bit more active, so they're going to be starting to build some muscle and require some more fat. They should be drinking whole milk unless otherwise recommended by a doctor. So depending on if there's a family history of obesity or diabetes, the doctor may recommend the parents have the toddler on 2% milk, but otherwise they should be on whole milk. So we can suggest foods the child can learn to eat and handle on their own. Back to the milk, sometimes babies, and then when they move into the toddler phase, they are not as receptive to the cow's milk from going from the formula or breast milk, so the doctors may recommend mixing the milk until they can be on 100% cow's milk. So when you let the child be able to handle the food on their own, it's starting to promote these habits, these healthy eating habits early on. So let's look at the next question. Which of the following statements is a key concern for toddlers regarding their food habits? Is it that toddlers are at high risk for choking and need to be monitored and assisted with meals? Is it that toddlers are likely to have no interest in eating meals? Toddlers cannot make healthy choices, so they should not be given options when it comes to mealtime? Or toddlers should never be given any utensils when learning how to feed themselves? And the answer is A. So it's that food safety is key in this age group. They're definitely at risk for choking, so the parents need to be educated on choking hazards. They need to be educated on cutting up the food into manageable bite-sized portions for the toddlers, and what to do if your baby is choking. Regarding choice C, toddlers actually can learn to develop a palate and should be encouraged to participate in food options. This will again get them to be learning what's healthy and not, and they can be more apt to follow up with these healthy choices if they're given the option. So the next group is going to be children and adolescents. So we'll start with children. So the protein demands increase at this age. Healthy diet and activity should be promoted to decrease incidence of childhood obesity. We will be discussing that in the forum, why the incidence of childhood obesity is such an epidemic in our country. And healthy options are not always easy with a child's busy schedule and school lunch routine. Now, the government has kind of stepped into the school systems and has been trying to regulate what's available for school lunches, but we still have a ways to go in order to really get children to be eating healthy. So issues in adolescence. So higher energy demands during puberty phase, so they're going to be requiring more calories. They're going to be growing, having growth spurts, and it's important that they remain with adequate intake. They might be more sensitive to their changing bodies, so it's important to educate the adolescents on what's normal, what's their body going to go through during this phase as related to nutrition. You need to promote healthy eating in a sensitive way because this group is really at risk for eating disorders and developing bad habits and unhealthy habits. So it's really important to talk to them about normal weight gain and do it in a sensitive way because they really may be really in tune with what's going on with their body right now and not knowing what's normal and what to expect. So question number 3. Which of the following statements is most beneficial when educating an adolescent regarding nutrition and well-being? Is it that it is important to maintain a healthy diet and exercise to avoid obesity and other major health complications at this stage in your life? Is it B, eating out is a good way to fit in and make new friends at this stage of your life? Is it C, you can eat whatever you want in this stage of your life as long as you stay very active? Or is it D, you should not be gaining any weight at this stage in your life? And the correct answer is A. Adolescents need to be educated on health risks associated with obesity and unhealthy lifestyles early on. They need to know, what will put them at risk for having health complications down the road or even at this phase. And it's also important to screen for drug and alcohol abuse and use and educate the patient during this. This is kind of the turning point in their lives, so we really need to be making them aware of the resources they have. And also, it's important to use sensitivity when addressing weight gain or loss, and be sure to notify the doctor of any concerns you have of their body image issues or disordered eating. You want to make sure that if they're gaining weight, that they're not having issues with their body image. This is going to be important for women and men, not just the women. So next group we're going to talk about is the older adult. So nurses will be assessing for physiological changes related to aging in this group. Some changes can be slowed down. At this phase of their lives, a lot of their organs might be changing, deteriorating in a way, but healthy diet and exercise can really help slow this process down. And supplements can also be very important in this phase. Also, it's really important to realize that elderly patients are at high risk for dehydration. For some reason, elderly people do not like drinking water and do not drink enough of it. The marketing out there for water bottles and hydration and everything is really geared towards the younger population, but it's really this elderly population we need to focus on making sure they stay hydrated. Being dehydrated at their age can really cause some major complications regarding blood pressure or just failure to thrive in general. So health issues in the older adult, chronic illnesses may cause more concerns for this population as as they get older. Anything they've been living with their whole lives are starting to affect other systems of their body. So it's really important to be screening for obesity, heart disease, and other issues. Dental issues are very important during this phase. Sometimes they stop maintaining their dental health, and it's important for them to be educated on what issues this can cause. So let's look at the fourth question. You're caring for an older patient. Which of the following is the most important to take into consideration? Is that the elderly patient may have outlived their family and spouse? The elderly patient will have an altered absorption of key ingredients or nutrients? The elderly patient has a higher demand of energy needs? Or the elderly patient is not at risk for being underweight? And the correct answer is B. So several factors result in an altered absorption of nutrients and medications in an elderly patient. Their organs are functioning in a different pace than they were before. So it's really important that dosing for certain vitamins and medications might differ from the adult patient. So it's important to recognize these changes. So let's talk a little bit about pregnancy. There'll be another video highlighting and reinforcing some more detailed nutritional requirements for the pregnant and breastfeeding mother. We're going to go through a few things. So the health and growth of the fetus is directly related to the mother's nutritional status. And a normal weight gain is for a pregnant patient is going to be 35 to 45 pounds. And this might be a little bit more for a patient that's underweight at baseline and a little bit less for a patient that's overweight at baseline. And prenatal vitamins can help supplement to provide adequate amounts of the key nutrients required for a healthy pregnancy, specifically folic acid you'll see in all the prenatal vitamins. So let's look at question number 5. Which of the following statements would be the most concerning for you as the nurse to hear while interviewing a pregnant woman about her current diet? Would it be A, I usually have a cup of tea, toast, and a banana for breakfast? B, I am a vegetarian. C, I eat ice cream every other night. Or D, I have either salmon or tuna as my protein every night for dinner. And this might be a little tricky, but the answer is D. So pregnant women need to limit their mercury intake, and most doctors recommend only a maximum of 12 ounces of seafood total for the whole week. So that would probably be around three portions of fish. So it's important to educate your patient on other forms of protein to eat throughout the day, and that also is important for the vegetarian patient. Oftentimes, a pregnant mom that's vegetarian has been a vegetarian for a while now and is used to getting enough protein in their diet. So it's really important to make sure that they are maybe adding some fish to their diet, but not too much. So we'll conclude here. So basically the nutritional needs shift frequently throughout the lifespan. The different requirements are really highlighted very nicely in your book. So it's important to use that as a resource. Because throughout the lifespan, a nurse is an excellent resource to educate and promote a healthy lifestyle. The different changes and requirements, the nurses needs to be sensitive about the issues that might come up with these different body changes to, not embarrass the patient or cause any issues that they're already going through. All right, thank you. I look forward to discussing this week's forum and next week's also. And if you have any questions, feel free to email me.